As adults and older children continue to get vaccinated, many parents may have questions about what activities are safe for them to do with their children who are not yet eligible for a COVID-19 vaccine, especially given concerns over variants. So today we want to provide some guidance and advice to families so they can enjoy the summer activities as safely and confidently as possible. While the statewide mask mandate has been lifted, it's important that we continue to be mindful of the recommendations from the Centers for Disease Control and Prevention and take steps to keep ourselves, our children, and our friends and families safe. The FDA currently authorizes the use of the Pfizer vaccine for individuals 12 years or older, and I strongly encourage any parent with children over 12 to talk to your child's pediatrician if they have not yet received their COVID-19 vaccine. At this time, we do not know when a vaccine will be available to younger children under the age of 12. As such, there's still a risk of COVID-19 spread among children. And please note that children, regardless of age, with underlying medical conditions may also be at increased risk of severe illness from COVID-19 compared to other children. As a mom to 2 young girls, I want them to have an enjoyable summer, but I know and they understand that COVID-19 is still spreading. So I want them to have fun, but I also need to keep them safe. DHS and our Office of Child Development and Early Learning, or OCDEL, want to reiterate guidance from the CDC and the Pennsylvania Department of Health. The CDC recommends that children under the age of 2 do not wear face coverings. Although masks are no longer required outside of healthcare settings, we should all follow CDC recommendations and be comfortable continuing to wear them in spaces where there could be a higher risk of transmission, especially while our younger kids cannot yet get vaccinated. Children between the ages of 2 and 12 who cannot yet get vaccinated should continue to wear a face covering in indoor settings, at events and gatherings, and anywhere they'll be around people outside of their household. This includes childcare and other early learning settings. If a child is unable to wear a face covering or is too young to get vaccinated, the CDC recommends sticking to more low-risk activities, such as enjoying activities outdoors with members of your household or attending small outdoor gatherings with fully vaccinated individuals. Risk of COVID-19 infection increases if unvaccinated children come from multiple households. So in situations like this, the safest place to visit is outdoors. Indoor activities can occur if all people involved are encouraged to take safety precautions, including wearing a face covering that fits snugly, staying distance from others as well as we can, and visiting in a well-ventilated space. This includes visiting with fully vaccinated grandparents without wearing face coverings or physical distancing, provided none of the unvaccinated family members are at risk of severe COVID-19. All of this guidance, regardless of a child's age or vaccination status, should be applied along with washing your hands with soap and water for 20 seconds, making sure your child and everyone else in your household keeps safely distanced from other people who don't live with them and people who are sick, making sure your child covers their mouth when they cough or sneeze, staying home if you're unvaccinated and sick with or tested positive for COVID-19, or were recently within the last 14 days exposed to COVID-19, and any person, regardless of vaccination status, experiencing new or unexplained symptoms still needs to isolate and be evaluated for COVID-19. Also continue routine doctor's appointments and vaccine visits. As summer continues and more Pennsylvanians are getting vaccinated, I know we're all hoping to continue or to return to some sense of normalcy. But this pandemic is not over yet, and we must be especially mindful given the risk and uncertainty around variants. I urge everybody to follow the CDC guidance and our recommendations today. We must continue working together to prevent further spread of COVID-19 between children and families so we can celebrate the summer safely. And if you and your older children have not yet gotten the COVID-19 vaccine, please do so as soon as possible. These vaccines are our most effective resource in our fight against this pandemic. Our progress can only continue if we're all doing our part by getting vaccinated and doing what we can to protect ourselves, our loved ones, and our communities. Thank you again to the Carnegie Museum of Natural History for having us today, and I'll turn things over to Dr. Deborah Bogan.
Thank you, Secretary Sneed, and good morning. I'm delighted to be here today to discuss the very important topic of how to keep our children safe. This is something that we as parents and guardians focus on always, even in normal times. Is the crib safe? Is the car seat installed correctly? We ask these questions and a million others constantly because that's who we are. We are protectors and caregivers, keeping our children safe. Now we live in the era of COVID and we face even more questions. As a pediatrician, parent, and director of public health, I'd like to focus on two things today: the recent CDC recommendations for schools and vaccinations. On Tuesday, the CDC said that universal indoor masking should be observed for teachers, staff, students, and parents in all K-12 schools, regardless of vaccination status. I strongly support these recommendations and encourage our schools to follow the guidance on masking and other mitigation efforts. Remember, children under 12 are not yet eligible for vaccines. They and other at-risk people are the most vulnerable populations right now, so we need to do what we can to protect them. Which leads to my second point, vaccinations. I spoke about this yesterday at my regular COVID briefing, but it's important to repeat it today. The single best way to protect our children is for everyone who is eligible to please get vaccinated. We have the solution to this pandemic. Get enough people vaccinated and we can stop the spread of this virus. Unfortunately, sadly, not everyone is on board. And as a result, the virus continues to thrive, mostly among unvaccinated, who are fertile ground for more variants to emerge in the future. Variants that are impossible to predict in terms of how dangerous or volatile they may be. So please, if not for your sake, then for your children's sake, please get vaccinated. If you know someone who's hesitant, reach out to them with care and patience, listen to them and hear their concerns. But then be sure that they hear you when you tell them getting vaccinated is not only about you. It protects our children, it protects people who cannot get the vaccine, it protects those who are vaccinated but are still at risk due to underlying health conditions, and it protects us all from variants. The data are irrefutably clear. The vaccines are safe and they are very effective. As I said yesterday, this is a pivotal moment in the pandemic, but we can triumph over this moment together with a shared determination to keep our children and our community safe. Thank you. Please be safe and be kind.
Just wanted to open up the floor if there were any questions for any of our guests this morning.
I actually have a question for you.
Sure. Would you mind,
Oh, yeah.
just so I can hear it, yeah.
So, I understand that you recommend that parents who bring their kids here have their kids' masks who are under 12 but over 2, but I am seeing kids around here who fall into that age group that are not masked. How do you kind of deal with that communication? Because I know you want people to feel comfortable, but at the same time, this is a public health emergency.
Yeah, we're not requiring that kids wear masks. It's a recommendation to parents, and it's a recommendation that we're receiving from our health officials. So it's up to the parents or the caregivers. You have a question for?
Why is it important to have like press conferences like this in spaces where families gather in the summer and whatnot, you know?
Sorry.
Sure. So I think it's important for us to have conversations in public places like this to just let everybody know that it's okay to continue to wear your mask, to remind people that we are still in the midst of this pandemic and that there are certain populations that are still at higher risk of spread of COVID-19, like kids who aren't eligible for the vaccine. So really it's just to raise awareness about the fact that we're still in the middle of this, but we should all feel empowered to wear our masks when we need to, or when we feel like we may be in circumstances where we're around people where we don't know what their vaccination status is. But I think talking openly about it helps families and kids feel more comfortable. Yeah.
Hi, how are you today?
Good, nice to see you.
You too.
So, you know, with the Delta variant being more infectious, we're expecting to see more children have severe illness, even though it's very rare, it's still possible. And I'm wondering if you could just address the fact that, or I'm wondering, are we going to see a higher percentage of severe illness among kids with the whole population that might get infected? Or, I'm sorry, I'm asking this really poorly. Basically, I'm asking, what are the chances of children developing severe illness with the Delta variant?
That's a great question. I haven't seen a lot of data that shows that children are definitely going to get the variant. The severity, I think there's some emerging data about hospitalizations just coming about, so I sort of am waiting to see what the data show in places where they've been seeing a surge a little bit before us. There's always a delay in hospitalizations. And so I think the data sort of reveal itself, and then we can have more comments. So I can't talk about the severity of Delta at this point. We haven't seen that yet here. I have to look at the more national data.
Yeah, what I'm seeing too is that there are places that are seeing spikes in pediatric hospitalizations.
Right. So there are places that are experiencing that. Because the virus, we've given people the opening to spread the virus again. And I just remind people that this is one variant, but we've had multiple variants, and the variants keep changing. And so the sooner we get our world vaccinated, the less the opportunity the virus has to keep changing and being more dangerous. And so, we all worry about our children and the risk of severe illness. And the last thing we want to see is our children's hospital full of children with severe illness. So that's why we're here today, really to ask people to spread the message, stop the spread by getting more and more people vaccinated, and to wear your masks when it's appropriate.
Sure.
Secretary Steve, so Dr. Bogan alluded to this in her comments about how we all kind of have a responsibility to vaccinate ourselves to protect our kids in our community, in our state. Is there anything you wanted to add?
No, I would think, as a mom to 2 kids who are not yet eligible to get the vaccine, the best thing that I can do to protect them is get vaccinated, right? So I did that as soon as I was eligible to get the shot. And now we talk often about wearing their mask and the importance of keeping themselves safe so they don't sneeze or cough on somebody else and spread any type of germ. We were just talking earlier about how our kids often remind us that it's time to put the mask on. They're very adaptable, and I think it's just important to make sure that they're not scared of wearing a mask or taking extra precautions if they might be around people who they just don't know if they're vaccinated or not. But I think what we can do as parents is lead by example. That's the best thing we can do, and that means getting vaccinated.
And it is a really scary time. So, you already kind of commented on this, but is there anything to add about how you mitigate or work with your children to make sure they're in a healthy mental state in this time of uncertainty and fear?
Yeah, I think continuing with regular activities so that it's not so disruptive for them is really important. So bringing them to places like this and letting them feel the enjoyment of the summer, but also making sure that they know that they should still be wearing their masks in most cases until they're eligible for the vaccine.